Hello, and thank you for tuning into McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall. And tonight, just like every night, I will try to get to as many questions as I possibly can. But first, I'd like to say hello to Dr. McDougall and Mary, Mom and Dad. Hi, how are you?
Hi. We're doing really good.
Good.
Had a nice dinner over at Craig's last night. We had lasagna. That's Heather's brother, our son, who's a medical doctor. But we of course had a healthy.
Well, you didn't tell him why we went there.
It was my birthday. Yeah.
We're celebrating his
You guys always have lasagna on birthday.
always lasagna. Yeah.
So you figure
We were on for Mom's birthday talking about lasagna last time, and
oh
now
my goodness.
you just had a birthday, Dad, and so happy birthday.
Oh, thank you. Thank you. Mary just pulled up, Mom did. She just pulled up an article about how Ozempic and Wegovy reduce the risk of cancer. It reminds me of when they had statins reducing the risk of Alzheimer's disease and pretty much anything else that you wanted. And it's because of what they do, Heather, is they make an association. Like, for example, statins lower cholesterol. And when you eat the rich Western diet, you raise cholesterol. Well, the rich Western diet also causes heart disease and Alzheimer's and so on. So they assume that anything that lowers cholesterol is going to reduce the risk of such and such a disease associated with cholesterol, like Alzheimer's. But it's just not the case. Just like Ozempic and Wegovy, they say that it reduces the risk of dying of heart disease. And by the way, these drugs, which are diabetic drugs, they were developed by the drug companies because of a complaint in 2008 by the FDA. See, what happened in 2008 is the New England Journal of Medicine published 3 major articles on aggressive treatment of diabetes, and all 3 articles showed that you hurt people when you aggressively treat them for diabetes. And the FDA told the drug companies, look, you've shown, and all we ask from you was you show that your drug will lower blood sugar, and you can't kill people within a foreseeable time. You can't have them drop dead in a day or a week. They got to live a little longer so you don't notice how they drop dead. So, we approved you all. The FDA said, we approved you all just for being able to lower a blood sugar number. You got approved. But these, actually, there were 6 studies. There were 3 published in the New England Journal of Medicine in 2008. They're the Accord, the Advance, and the Veteran study, in case you want to look them up. Showed you increase the risk of trouble, including the increased risk of cardiovascular disease, so much so that the National Heart, Lung, and Blood Institute stopped the Accord study 17 months early because it was killing people. All right, so the FDA came out and said, look, you guys gotta make drugs that lower the risk of dying of heart disease. All right, so they did. They made this Ozempic and Wegovy drug, the semaglutides, the GLP-1 agonists that we've been talking about. You know those things, right? They lose weight. Well, they're originally developed for diabetes, and they lower blood sugar, but they also cause weight loss, which is why people are buying them now. But weight loss is associated with less cancer. Okay, trimmer people have less cancer. Trimmer people have less heart disease. Trimmer people have, less of high blood pressure, lower cholesterols, et cetera. So because of the weight loss, we have an associated improvement because people aren't eating. That's the way these drugs work. They make you so darn sick you can't eat because they're not eating. They're eating less cholesterol because, they're eating the American diet, which is loaded with cholesterol. Remember, only animal products contain significant amounts of cholesterol. So they're so sick from taking the Ozempic and the Wegovy that they lose weight because they're not eating well. They're eating less cholesterol, less fat, less sugar, less junk. Anyways, their diabetes improves, their cholesterols go down, their blood pressures go down, et cetera, because of the weight loss. So now what they've done is taken the extra liberal association, which is incorrect, that says that taking these drugs will reduce your risk of cancer. No, taking these drugs causes you not to eat the foods that cause cancer. Okay?
But if you're reading,
and you lose weight, and that's associated with less risk of getting cancer.
well, if you read a little bit further down on Google, because I saw this in the newspaper and I saw just a little thing that said Ozempic and Wegovy have been shown to reduce the risk of cancer.
Right.
So I went to Google and I looked it up. And so the first two articles say that, yes. But then you read a couple articles down further and it says that Ozempic and Wegovy have been shown to increase thyroid cancer.
Yeah, but just in mice and rats and things like that.
Okay.
But they warn you not to take it if you have a history, familial history of multi-nodular cancers or thyroid disease or whatever. Gee, ladies and gentlemen, these people are cheaters and liars, because they fool the public. It's not because there's something inherent about Ozempic and Wegovy that reduce the risk of cancer. Not as like you improve the diet, which causes cancer. You just eat less of it and you lose weight. And weight is associated with heart disease and cancer and gallbladder disease and all kinds of things. So the fact that you lost weight shows that your risk factors go down. I gave you an example. I used it with low carb diets, and it's well worth listening to what I did. Is Mayo Clinic Proceedings. They published an article. This is a medical magazine, journal, so to speak, out of Mayo Clinic. They published an article of a group that showed that low carb diets, keto, Atkins, that kind of nonsense, grain brain, etc.
Paleo.
No, I didn't include paleo.
Okay.
But anyway, they showed that those kinds of diets reduced the risk of dying of heart disease, et cetera, because those kind of diets, because you didn't eat and you lost weight, those kinds of diets were associated with a reduced cholesterol, reduced blood sugar, reduced triglycerides, reduced body weight, and so on. I went back and I published it in the Mayo Clinic Proceedings. They published it. I said, you can accomplish the same thing by giving a patient cancer chemotherapy drugs. They get sick, they don't eat, their cholesterol goes down, their blood pressure goes down, their blood sugar goes down. But what doctor would brag about a weight loss program that prescribed cancer chemotherapy drugs to the patients? Who would sign up? Well, you signed up for a diet regime that makes you sick. Why not cancer chemotherapy drugs that make you sick? Or just pick a few poisons. Well, maybe chronic arsenic poisoning would do it.
No, I was going to say, actually, probably the cancer chemotherapy drugs are cheaper than
Ozempic. Oh, I know they are. Anyway, you're getting lied to, okay? And they're getting away with it. And I think that someday my colleagues are going to stand up to their drug companies and put them in their place. They've done it before.
When?
In the 70s.
Okay.
They had the dietary goals of the United States. They stood up for the American citizen. In the 60s, we stopped Luther Terry, stopped cigarette smoking with, smoking and health in the United States with the Surgeon General's report. I mean, they got real integrity back in the 60s and 70s. We were going to do the best for all mankind. Then industry said, screw that. We're making money. We're going to drill, baby, and we're going to give you as many drugs as you'll buy and as much garbage as you'll eat because we got the money. But I do believe there's a segment of honesty that needs to appear again in my colleagues. Please, guys and gals, please. You swore an oath to care for your patients.
Well,
you swore an oath to do no harm.
They're wanting to learn.
If they can make money off of what they learn. See, what we have to do, Mary, is we have to figure out a way for medical doctors and hospitals to make money by keeping people healthy. The drug companies too would be nice. Yeah. I can only figure out how to do it with my colleagues, the doctors. What you do is you do capitation, which we tried to do in the 70s. Capitated medical care is where the government or the insurance companies and the government gave you a big bucket of money and gave you some patients, say 500, 1,000, 1,500 patients. And you had to take care of those patients with that bucket of money. Now, what was left over, you got to keep. So what my colleagues did, because they didn't know anything about diet, they didn't know the big buck to reducing expenses, which is to get all your patients well. I mean, what they did is they sent them home from the hospital earlier. They gave them more generic drugs, took them off of some medications, actually. That's what they did. And they got just a tiny bit of profit, and it wasn't worth their trouble. They'd rather work for the drug companies who were just loading them with gifts pizzas and trips and, vacations and opera tickets and sports tickets. Man, these drug companies, they are so good to my colleagues.
So that's why capitation never made it.
Yeah, I never made it. We still have Kaiser. We still have Kaiser Permanente, which has a chance to switching over to a moral fiber, but they haven't so far. A little bit. Kaiser's pretty good. I like Kaiser.
Okay, you ready for some questions? I've got lots coming in.
And I have nothing to start this conversation out with this one.
I've got dozens of questions. So first one from Jeffrey. What do you think about B12 injections?
Oh, I used to give them. Again, I have I might as well tell you, I've got a half a century of experience, so I'm not going to hide it. What I may lack in terms of brilliance, so, I make up in terms of experience. Isn't that what you heard that from the political scene these days? Yes. Well, I have a lot of experience. And we used to give a lot of B12 shots. Now, back then, we really didn't recognize B12 as a possible issue with diet, because there were virtually no cases. But they started talking about it a little bit. They found one case here, a couple of cases here. I think we found a total of 6 cases in the entire world literature. Anyway, they weren't giving B12 shots for diet issues back then. They were giving them when people had ulcer operations. Mary, you were a surgical nurse at that time. And they used to do gastrectomies and vagotomies and pyeloplasty.
I remember giving them for other reasons.
Yeah, that's because you worked for a quack.
That's probably true.
You did. You worked for a diet doctor quack. So, you give them for everything. You're tired, get a B12.
That's what we gave for. We had people that came into the office that were tired. And
legitimate reasons. Like I say, the guy you worked for gave HGG shots. You get horse urine shots.
Yes.
So you needed to pay your rent. I understand.
Well,
You didn't know me back then.
Oh, you? Yeah, I know, and I can't speak for him, and he's not around anymore. So
I hope he's dead. No, I really don't.
No, but he is.
He's dead. Thank goodness. This guy who did not contribute positively to society. I wouldn't wish anybody dead.
B12 injections. Do you recommend them or not?
So we used to give them legitimately. We used to give them for when the stomach was damaged, either through pernicious anemia or gastric surgery. That was the indication to get it. You used to give 1,000 micrograms. Buy it in a bottle, shoot it up with a syringe.
we also used to give them to people that had tingling in their toes. Would that be a reason?
That'd be a reason.
A legitimate reason? Maybe?
Well, except that it's extremely rare to have
Okay.
that condition. But yeah, it would be a reason. When you are really B12 deficient, one of the first signs and symptoms is numbness and tingling in your toes and fingers. They say, and I'm not sure it's true, but I can go for the reasons why I'm not sure it's true, but I accept it as being true. Okay. Why? Because it's better to err on the side of doing no harm and consider there may be a potential for B12 deficiency. So, you know, I've been given B12 my whole career. All the books tell you to give B12, but the risk of B12 deficiency is like 1 in a million. There's an article in 1992 in the New England Journal of Medicine. It's actually a letter to the editor. Vegan diet causes blindness. Look it up. It's a story about a 20-year-old vegan, or a guy who'd been on the vegan diet for 20 years, and he went blind. Okay. I read the initial, this is a letter to the editor. This is not an article. Okay.
Not a research.
There's not a research. It's just a letter to the editor that somebody wrote in and told this story. So I'm reading the article about this guy going blind. And I start reading what his diet was and started reading the deficiencies in his diet. Well, he was deficient in beta carotene, vitamin C, folic acid. He ate virtually the unhealthiest diet you could imagine. So to blame it on B12 was unreasonable. A couple issues later, a letter to the editor came out from people who were interested, and they wrote the same thing. We noticed that this vegan was severely nutritionally deficient. It wasn't just a B12 problem. So that's the kind of level of evidence that people give for you got to take B12 if you're on a vegan diet. They've got a few cases like that, basically, and they've got some biochemical changes that take place when you're on a B12 deficient regime.
So, well, would you say B12 shots are harmful?
No, I don't think so.
Oh, okay.
Except, okay. anyway, I think it's safest to tell you to take B12. Mary and I take B12. Does no harm, except for Mary about 6 months ago. There were some articles, that I read medical journals all day long.
All the time.
There was an article in one of my journals that said there was an association between B12 deficiency and lung cancer.
Oh, okay.
All right.
What, you mean if you have
If-
B12 deficiency, you could get lung
No,
cancer?
if you had, excuse me, it was B12 excess and lung cancer.
Oh.
Thank you for correcting me on that.
Okay,
It was people who had high B12 levels have high incidence of lung cancer. But you have to understand, people who have high B12 levels are the ones that eat a lot of B12 containing food. So B12 is considered a luxus vitamin. You have like 10 times more than you need in your body, stored up in your body for like 20 or 30 years. It's a luxus vitamin. You'll never run out of it. But anyway, so people who eat a lot of B12, the Western diet, taking lots of meat, et cetera, they have a higher rate of lung cancer. Why do we know this? It's because if you look at the Japanese, this was done in the 60s, where 60% of the Japanese males smoke cigarettes. And you compare the risk of dying of lung cancer between an American who gets lung cancer and a Japanese person who gets lung cancer, the risk of dying of lung cancer is 4 times greater among the Americans. Why? Because when you eat the Western diet, you can't defend and repair as well from the toxic elements of the cigarette smoke. Whereas the Japanese who eat a low-fat, low-cholesterol, high-starch diet, even though they damage themselves with cigarettes all day long, they have the ability to repair and defend, and they have lower B12 levels. Again, it's another marker. People look at markers because, well, you don't have to change your diet, just take a supplement. And somebody makes some money. We keep the expensive American diet go on, and we keep the supplement sales happy, and nobody ever gets better. So the hospitals are thrilled and the doctors are busy. It's just so nice. And you're sick, and so are your children, your family, your spouses, your dad, mom and dad. It's not fair. I think so. Not fair. Now, if we could tell the truth along with the lies, and you had a choice, that'd be fair. I don't mind having an open market and loads of information, but what's happening is the truth is being suppressed. Has been, still is. Drug companies, food companies, they've got spin doctors. Anytime something comes out that may in any way threaten their products, they get the spin doctors busy and they lie. And only somebody like myself who understands the scientific method and who reads the science carefully can figure it out. But I don't think there's a case where I haven't been able to figure it out. At least I did, or chasing down the resources and the attachments that the authors have to the drug industry and the supplement industry. I eventually figured it out how they lied. You don't. I do. That's why you should listen to this show every Sunday night at 5 o'clock Pacific time.
All right, thank you.
And if you get really desperate, and you're tired of taking the pills and being overweight and being sick all the time, you could join us for our July 12-day program, and we'll change your life. We will, ladies and gentlemen. We will work for 12 days, day and night, and you'll have a response just like the people we got done with last week. I mean, they just couldn't believe it. They could not believe that they got what they got in 12 days, and they improved as much as they did in 12 days. Anyway, July, I think, is the next one. But we'll be here every Sunday night at 5 o'clock Pacific time.
Okay, next question. This is from Rebecca. She wants to know what you would recommend for someone that has severe osteoporosis.
I would recommend somebody who has severe osteoporosis to be very careful about whether or not they take the standard drugs, like the bisphosphonates, Actonel. But you got to be careful because these drugs, not only being toxic and expensive, have such a small benefit. When you look at it in terms of absolute benefit, look up on my website, The Broken Bone Business. So a lecture I gave called The Broken Bone Business. And you'll find it, I discuss Actonel. Anyway, they're called bisphosphonates, the category. And I show you how they cheat. And it's right there. You want to figure out a way that they cheat. They do it by giving you relative statistics rather than absolute statistics. First of all, the benefits of standard drugs are almost nothing. But they are something, or they wouldn't get away with it. What I recommend is you eat a low acid diet, which is the diet we teach. We teach an alkaline diet, base alkaline, pH above 7, not acid, alkaline. Okay, we eat an alkaline diet, which sets up our alkaline system. Our system has a pH of 7.4. So when you eat on that side of the number 7, you contribute to the alkaline nature of the human body, which is good. If you eat on the other side of 7 is neutral. You eat on the acid range, then you have to neutralize the acid you eat. The American diet is full of acid. You know that. It's a high protein diet. Proteins break down into amino acids. Did I say acids? Proteins break down into amino acids. So a high protein diet will have a lot of acids. And the kind of acids that are contained in animal foods, eggs and dairy and meat, they have a special kind of amino acid. Oh, no, it's not unique to them, but they have a higher amount than usual as they compared to plants. And these are what we call your sulfur-containing amino acids, like methionine and cysteine. And they break down to sulfuric acid, which is a huge detriment to the bones. So the bones have to dissolve to neutralize this dietary acid. So that's one thing you do is you fix the diet. Second, you get some reasonable, moderate, safe exercise. And third, you do the same thing with sunshine. As long as you don't burn yourself or damage your skin, you can get plenty of sunshine. You don't want to go to the point of skin damage, just to the point of pinkness. Just get your skin a little inflamed. That's enough. Get out of the sun. That's all the D that you're going to make, all the bone building D you're going to make, because your skin just turns slightly red. All right, so you get in the sun, eat a good diet, you walk around safely, and then what do? Well, there are only 2 other things that I recommend to my patients. And they're, number 1, add an antacid to neutralize the dietary acids from the animal foods. The antacid could be something as simple as Tums, but it's the alkaline part of Tums that makes a difference, it's not the cation, it's the anion. It's not the calcium, it's the carbonate that makes the difference. It neutralizes the acid. Anyway, you add a little bit of antacid, magnesium, macromagnesium will give you diarrhea. Maybe you shouldn't do that. Aluminum hydroxide may give you Alzheimer's disease. Maybe you shouldn't do that. Calcium carbonate, or in other words, Tums, may increase your risk of dying of heart disease. We'll have to accept that one. Because I don't have any other neutral one to give you. Maybe potassium bicarbonate. I don't know. Anyway, you take an antacid, and the last thing you do is you take hormone replacement therapy, because estrogen builds bones. I know somebody who listens to this show objected to that, but I'd be glad to show you the science if you can't find it. Estrogen builds bones, always. So I give hormone replacement therapy. It's discussed in chapter 13 of a book I wrote called the McDougall Program for Women. Chapter 13 is on hormone replacement therapy. It tells your doctor how to write a prescription for skin creams, for estrogens and progesterones, and maybe a little testosterone if you want to throw that guy in. I don't think so. Not a good idea, but you could try it. I don't know. I know. You think the testosterone is going to make you feel like you're 20 again. It doesn't. It doesn't work. Not even, you end up smelling like a man. That's the problem with taking male hormones. You end up stinking like a man. Think about that, ladies, next time you decide you're going to choose something attractive like a male hormone.
No thanks.
Yeah.
All right. Well, those other tips for osteoporosis were great. Thank you.
All right.
Okay, next question. This is from Catherine. I'm probably going to mispronounce this. I'll do my best. My husband was diagnosed with monoclonal B-cell lymphocytosis. Do you know what causes this and whether following your diet would help?
I don't know whether following our diet would help, but I certainly would follow our diet because it'll do no harm. Lymphocytosis means that the lymphocytes are multiplying in greater numbers than they should be, but they haven't shown elements of lymphoma where it's out of control division of cells. So maybe this is a pre-lymphoma state. I'm sure that's what they've scared him with, or at least he's come to that conclusion because it's called lymphocytosis. Okay, I would have to just make things up, but I'll do that for you. I don't know. I don't know whether the diet will help. Why should you do it? It does no harm. And I get surprised all day long by what will happen to the human body when you give it a chance. But let me give you some possibilities. The white blood cells are made as a consequence of chronic inflammation. You get infected, get appendicitis, you get an abscess. What happens is your lymphocytes, you develop a lymphocytosis. So chronic inflammation, infection is one form of inflammation. Chronic inflammation would cause the white cells to have more produced, a relative lymphocytosis. Where do you get chronic inflammation? Well, the Western diet does that. One of the big complaints I get from people who follow our diet and go to the doctor and get a CBC done is they say, my white count is now low. And my doctor's worried about me because it fell out of the normal range. It fell down to a low level, say 2,000 or whatever. It should be 4. Everybody else is 4. Well, everybody else eats the Western diet and they're sick because of the foods. They're chronically inflamed because of the diet they eat. So we get a common complaint of people. They say, okay, I've been on your diet, got healthy, but my white count, lymphocytes, lymphocytosis is low. All right. So that's one of the things that I would say. The other thing is lymphomas and leukemias are caused by a virus. It's called the bovine leukemia virus. And it's in beef, it's in dairy herds. It infects 9 out of 10 herds in this country. 89% of the dairy herds in the United States are infected with bovine leukemia viruses. And these are viruses that we think you should be concerned about. Not just us, but UC Berkeley, their science and infectious department who did the research, they think you should be concerned about it, about eating cow leukemia viruses. And anyway, they did one study at Kaiser in San Rafael, where they looked at 98 women. They took them out of the emergency room or the waiting room. They asked them to volunteer. And they found in 1/3 of the women that they had live bovine leukemia viruses in their cells. 1/3 of them were infected with active viruses. And if you take viruses that are dead and alive, somewhere around 74% of people have been infected in the United States. But not in Finland, not in many European countries. Why? Because they killed all the sick cows, because they thought it was a problem to feed tall glasses of leukemia virus to their children. Those people in Finland and other parts of Europe, they thought they shouldn't be doing that. But in the United States, we do. In Canada, we do. In Argentina, we do. Wherever cattle's a big business, we do. I bet you thought you were going to stick me on that one, huh, Heather? Anyway, I don't know. I don't have any research that says that our diet causes or will help. I do who will help, but help specifically that problem. You'd be silly not to eat well.
Okay, next question. I know you've been asked this before. What's your opinion about Amla powder?
Is it alum? A-L-U-M?
AMLA.
Oh, yeah.
Oh,
Yeah. What was it for? I forgot.
For diabetics, right? I know mastering diabetes is big on Amla powder.
Well, whatever it is, let's see.
It's a gooseberry.
Those gooseberry, I don't know.
Yeah.
Probably not going to hurt you.
Amla berries are a source of vitamin C.
Vitamin C and vitamin E, but a resource here. There are all kinds of herbs and minerals that are recommended for people with diabetes. I haven't been impressed with any of these supplements. They likely do you no harm. They don't cost you a ton of money. I ask you, if you decide to go this route, to do an experiment. Within 4 months, I give you 4 months. If you're not going to be healed in 4 months, go on to another guru. Set up an experiment where you say, okay, I'm going to take this particular supplement. and I'm going to objectively see what happens to my body weight, my cholesterol, my blood pressure, how I feel, etc. Give it 4 months. And stop wasting your money. And you know, a lot of these things like berberine, we talked about that a lot lately because people have brought it to my attention. You folks have educated me on a herb that lowers cholesterol, berberine, berberine. And it lowers cholesterol, but it doesn't, as far as we know, reduce the risk of dying of heart disease. All it does is lower cholesterol. It's probably like statins, where it has minimal benefit when it comes to translating into a better life. But I don't know, because no one's done the studies on berberine. But I would guess it just lowers cholesterol. So try and have some type of goals set out that you expect this particular miracle approach to take. Like, I challenge you, any of you, to listen to what Mary and I and Heather have to say and put us to the test. Put us to the test. How long will it take for you to get better? You'll start seeing improvements within 4 to 7 days. Did I say 4 to 7 days? Not 4 to 7 years, like your supplement people tell you? No, 4 to 7 days. And if you're not better by 4 months, you're likely not going to get better. Not with our approach anyways. So that's how quick the body heals. And somebody who's telling you different hasn't had the experience I've had. I've been watching bodies mangled and diseased and heal for 50 years. Okay, you show somebody else who has that kind of experience, and I'll listen to what they have to say. In 4 months, if you're going to get better, you're going to get better. Otherwise, you're not.
So as you're talking, there's someone writing in named Chad, and he says, 2 years ago, he started out at 345 pounds. This morning, he's 215. He's lost 130 pounds. He says he feels like he's 25 again.
Yeah. Yeah, that's what I should have mentioned. It takes longer to lose the weight if you're 150 pounds overweight. But you know, it's like you imagine, like you cut off your finger and you decide, I'm going to start eating kale. And if my finger doesn't grow back, then I'm going to stop eating kale. It's not going to grow back, folks. It will not grow back. I can tell you right now.
No matter what you eat.
I've had enough experience with cut off fingers. I've worked in many emergency rooms, and I know they don't grow back. In other words, what I'm trying to tell you is what can be fixed is fixed within 4 months, except for all the weight. Great story. Thanks for telling that.
Yeah.
But we've got thousands of stories. Like, we know we're lacking in stories of people who follow our advice, who don't get more than they expected. Not just what they expected, but they end up getting more than they expected for less effort. You think we'd be in a winning situation where everybody would be following us, but we're not. And I think I know why. I don't have $10 million every year to advertise to you a bunch of nonsense, so I don't have to.
No.
I have this cheap little YouTube channel. That's what I got.
All right, next question. This is from the Primaveras. They want to know if sarcoidosis is a diet-related condition.
I think so, Heather. Again, I'm like a broken record. Okay, sarcoidosis is, it's a connective tissue disease that's due to chronic inflammation. And I'm not going to go through the whole labor of talking about chronic inflammation, but no, it's not.
It is. I mean, that's what they say. It's
I know.
Inflammation and scar tissue.
Okay, well, it's been a while since I've dealt with sarcoidosis, but there is some evidence that sarcoidosis may be a dietary disease and fixed. I actually had a couple of patients that got better. Now that you bring it up, and I think back, I go to the deep memory cells. I can remember a doctor who had terrible psychosis, and she actually reported that all of it went away. She was from India. So you're bringing up some memories, but I don't have any research that says so. But it's due to chronic inflammation.
Yeah.
Some people thought it was due to chronic infection, but that was due to some kind of microbe, some kind of prion or something. But I think it's just the end product of inflammation in some people. But I do,
Looks like
I do,
people have it.
yeah, I do have a couple of people I can remember who got tremendous results. So put that in your pipe and smoke it, so to speak. It not going to do you any harm. Get it 4 months. Not going to cost you anything.
Okay, next question. Mom, this one's for you. Can you share your bean pizza recipe? I think you've talked about that on YouTube, and someone wants
Love
to know
it.
it's not on our website.
Love
Yeah,
it. Write this one down.
Well, I just take a pizza and I found, well, there's a couple of pizza crusts that you can get. One of them is made by, what is it?
Bubbly.
No.
Engine 2.
Engine 2, yeah. The one that you can get. And I read about another one this morning. I'll see if I can find it. That you can actually buy online. And they warn you that it might come, it's very fragile. So they don't guarantee that it's going to come in one piece. So I'm not sure. The best way to do it, I think, is just to take some pita and split it in half and make your own pizza crust this way on the bottoms of pita bread. Otherwise, you can make your own pizza crust.
Wasn't there a place in Texas that we got them from?
There was, but they're not.
Okay.
They're not around anymore. We used to get them shipped by the box full. Yeah, unfortunately. So you either make your own or you buy one of those that you can find in Whole Foods. And then I take, usually I have leftover beans that I cook in a slow cooker until they're really soft, and I mash them. So it's basically fat-free mashed pinto beans that I spread all over the crust. And then on top of that, I put, let's see, usually I put some salsa on top of that and some green chilies and sometimes black olives, sometimes not. And then I bake that in the oven until it's done. Usually takes about 10 minutes. And then when it comes out of the oven, I add chopped tomatoes and shredded lettuce and some more salsa.
I was going to say, where's the salsa? I like that salsa.
Well, I put salsa on the top of the beans, and then I put it on top of the.
Ooh, that really makes it really great.
So it's very simple. We're going to have it again in a few days.
I like that mango salsa.
I know you do.
I could eat that on anything and like it.
You found a tomato salsa made with mangoes and tomatoes, and so it's kind of sweet and spicy.
I have it on everything. But I don't put sriracha on. I put that on.
Yeah, that's true.
I love it. Okay, thank you. Let's see. Next question. There's so many coming in. Have you ever heard of eosinophilic esophagitis? Mary's been suffering with this for over 15 years. She does eat a vegan diet.
Well, eosinophilic esophagitis. You're asking me about things that I haven't.
Lots of hard questions tonight.
Yeah, it's hard, but obviously these people are suffering a lot. There was a concern that eosinophilia was caused by, and these were the cases that I saw back in the 70s and 80s, probably the 80s. It was caused by people taking supplements of tryptophan. The tryptophan used to be given for depression until the regular drug manufacturers who make antidepressants discovered it works, and then they made it illegal to sell it. But anyways, I used to cause eosinophilic esophagitis. But otherwise, again, I go back to the same discussion I just had about the lymphocytosis. I have no research that suggests that it would cure, except that I do remember a couple of patients that I took care of a while back. And I think they did better, it's been a while. If it works for you, it's 100%. And it doesn't take you long to figure out whether it's going to work for you. You'll know in 4 months. And what have you lost? You cut your food bill by 80% if you go out to dinner. Your bowel movements, you've had great bowel movements for the whole 4 months. You've lost probably up to 40 pounds of excess body fat. You dropped your cholesterol probably 40 points. What have you lost? And if you even go back to the Western diet, You've gained a whole repertoire of great recipes by going off in this divergent path of eating the diet that is most likely to give your body a chance to heal and stay healthy and return to its previous appearances that you enjoyed so much when you were younger, which are gone now because of the food. You've lost your personal appearances. You know what I'm talking about. You're not just overweight, you're greasy, you're gray, you're cyanotic looking, you've lost your hair, you stink bad. Get over it.
Enough.
Enough.
No.
But all those are true. You know, you can imagine when you eat the Western diet, what you smell like. Pigs and cows, chickens.
That's why they sell so many deodorants and perfumes.
You don't want to smell what a carnivore smells like. They stink. That's one of the things about the Atkins diet that people used to complain about, is such bad breath they had. 70% in a study he did, a study he published, which I discussed in my 2004 newsletter on Atkins. The first study he did, one of the first studies published, like 70% had halitosis. and were constipated. Maybe 60% were halitosis, 70% were constipated.
And he did the study himself.
He paid for it. Yeah, Robert Atkins paid for it. It's on my website, 2004. Forgot the name of it. I'll think of it in a minute.
I found the pizza crust, by the way, that you can order online. It's made by Sammy's Bakery, SAMIS Bakery.com. And they have a millet and flax pizza crust that's oil-free. And it's thin, and then you have something that's in your pantry, and you can have it all the time. So
it just stays there without any refrigeration.
yeah. Let's see.
I know we get some things. We get some things in these refrigerated cartons.
Yeah. Yeah, this is, I think, I don't know. I use the other one. The one from Rip doesn't have to be refrigerated. It's in the vacuum pack.
When she says Rip, she means E2, which is
Engine 2.
at Whole Foods markets.
Yeah.
Engine 2. Rip
You can
has
get them online too.
Yeah. That's true.
Okay, next question. Can you talk about snoring and sleep apnea and how long it takes to cure yourself of this condition?
4 months. No, you got to lose the body fat. So if you're 150 pounds overweight, it could take you 15 months to lose the weight. Almost all sleep apnea is due to obstruction of the oral pharynx by the excess fat. There's something called a central, which is due to the brain activity. Very rare. You know, almost all of it's due to being just too fat, obese, pudgy, just really big. And what you use is a CPAP machine, which is a really, really good invention. So if you have sleep apnea, I recommend CPAPs. People's lives have changed overnight. What a CPAP does is it keeps the pressure, the atmospheric pressure, higher, so that when you exhale into a higher atmospheric pressure, which keeps more air in your lungs, which prevents you from having the signs and symptoms of sleep apnea. And one of the signs of sleep apnea is snoring. Of course, you know that you got to balance the snoring against the noise the CPAP machine.
About that, don't they have?
Yeah.
Haven't they come up with something that's a little more quiet?
Probably. They probably have better machines.
Because I remember they used to be really noisy.
They certainly have one you can wash your CPAP with. They sell that one on.
Yeah, they do. Okay.
All right. Well, the bottom line is, well, first of all, you can raise the head of your bed. Okay. Not bend your body, but straight. Raise the head of your bed. So just sleep with less of your abdominal fat on your lungs. Okay. A little gravity to pull the fat down towards your pelvis. So you do that, you sleep with your head of your bed raised. And then the next thing you do is you get a CPAP machine. And in the meantime, you lose the fat, which is causing you problems. And how do you lose the fat? The fat you eat's the fat you wear. Ladies and gentlemen, the fat you eat's the fat you wear. Stop eating the fat. I know it's good fat. I know it's good fat. And my local supplement salesman wants me to buy it. This good fat, because good fat's prettier than bad fat. No, it all looks the same, folks. whether it's good fat or bad fat, vegetable fat or animal fat, it's disgusting when you have to wear it in large amounts as a double chin. A double chin.
Next question. This is from DC or Dahlia. Do you think medical marijuana is okay to use for arthritic pain?
I'm going to stay away from that one, Heather. The answer was, in my non-professional opinion of having had little experience, I would say yes. It's probably a relatively safe pain medicine. And it used to be unsafe because the police were right around the corner. Now it's safe in most states, for a lot of states. But you're going to get a lung irritation. It's going to cause chronic bronchitis. Plan on it. You're going to cough. You're going to wheeze. You eventually may develop emphysema, serious emphysema. I've seen it. Even though the literature says smoking pot, marijuana will not cause emphysema, I've seen it in patients that were not tobacco smokers. You know who exactly I mean.
I do.
Mm-hmm. And have lost their lung function from pot. Of course, they smoked a lot of pot, but it's a drug. It's got good things and bad things. But if you want to, they say marijuana heightens your sensation, so maybe make the pain worse. Yeah, you'd have to experiment, I think. But that's enough.
Okay, next question from Anthony. Do you know what MTHFR is?
MTHFR.
I do, but I can't remember. It's multi-something. I don't know. What is it, Mary?
I'll tell you in a minute. It's a gene mutation.
Oh, yeah. Okay. Yeah. I do remember, but what do you want me to tell you about it? I don't really know enough about it to talk.
Well, the question is always whether diet can fix it.
Well, here
Well,
it's fatigue, chronic pain, brain fog, depression, and anxiety.
Yeah.
And headaches.
Well, they say it's a gene problem. You're not going to fix a gene problem.
Gene mutation.
I think it is. It's a biochemical thing that
What food should people with? All right, here we go. Anti-inflammatory diet.
Well, that's our diet is anti-inflammatory.
Yeah, there we go.
Yeah. People who teach you that a vegetarian diet is an inflammation-inducing diet, they just haven't read the science. They're lying to you. If you read the science, put in inflammation and diet, you read it. It's consistent. It's the animal foods that cause the inflammation, not the vegetables. But you knew that.
But people don't want to talk about that.
You knew that because you know your friends who are heavy into the Western animal-age diet are sick. They're all inflamed. Those of you who have changed to a healthy diet, you feel good. You're not inflamed. You don't have aches and pains. You don't have fibromyalgia, which somebody started this whole hour asking me about. Didn't they start this hour?
No, I think that was the last hour.
That was the last hour. Okay.
He was giving talks all afternoon.
Yeah.
I heard you did something for a climate event today for Linda.
Yeah, which is something I should probably mention since you brought it up and I never do. Is we have one site that's ours that's dedicated to diet and climate change. It's called McDougallFoundation.org. I'm going to say it for you again. It's really easy. McDougallFoundation.org, not .com, but .org. And it's a whole website dedicated to you personally changing your diet to be climate friendly. Okay, that's good. And I will hope someday it'll be a very popular site. I just put it together. Mary and I did. Took us about 1.5 years to do it. There's another website that has nothing to do with me except for it's the only hope I think we have. Are you ready for the only hope I think we have? I really mean it. I really mean it's too late to handle the fossil fuel problem. It's not going to do it. Or change it to a vegan diet. It's not enough to reduce the CO2 levels to livable levels. I don't think you can reduce the CO2 levels to livable levels, but you can reflect the sun's energy back into outer space. And that's done. That's done with the use of mirrors, 10-foot by 10-foot mirrors that are made of recyclable plastic bottles and aluminum cans. And the energy to make them right now is supplied by fossil fuel, but at a conservative amount of energy in terms of return. But soon they expect to be able to make these mirrors using the sun's energy, using non-polluting energy. The website, as you probably figured out, and I'm going to give it to you right now, so get your pencils ready, is called meer.org, MEER.org. And, if you could tell everybody about it, I think we have to uncouple the CO2 problem, which is unsolvable, folks. We have to try. We have to, if we're going to be around in 1,000 years, it's going to be real important that we fix this CO2 problem. But for the next 10 or 20 years, if you're going to fix the problem so that you can live on this planet, you're going to take advantage of something like Yi Tao. Yi Tao, that's his name. Massachusetts Institute of Technology, really smart guy, put together, and he's doing projects that show you could cool the planet. All we have to do is have it politically acceptable worldwide. We got a chance with mirrors.
Thank you. I shared that link the website in the chat.
All right. Well, Heather, it starts one place. You never know who out there is listening, who's going to make a difference. We have friends in high places. They have, even though I've appealed to them, very, very public persons who could make a huge difference. They have not shown any interest. They haven't even looked at the MIR website. They just decided they don't want to hear anything about it. That's how upset people are about the climate and some of the nonsense that's come out. So, one of you out there is going to make a difference.
Okay, thank you. Let's see. Next question. This is from Esther. She's been plant-based since 2005, but has been noticed recent memory loss, not being able to remember names, events, or past experiences. Do you have any suggestions for improving her memory?
Yeah. In fact, I gave a whole lecture on it. When are we going to do that lecture, Heather? When are we going to do it again? We unleashed it on the public twice, and maybe it's ready to do it again. It's called Aging Gracefully and Preventing Dementia. And it's a whole 2-hour presentation on how you should age gracefully and how you should prevent the dementia from occurring. And it's the food. It's the food in the sense that you can preserve brain integrity as seen by brain volumes. In other words, if you feed a diet close to ours, they actually use the Mediterranean diet that was modified to be closer to the McDougall diet in this experiment. And what they looked at is what happened to the brain over the 18 months, whether they followed the American diet or a modified Mediterranean diet, modified to be like the McDougall diet. And what they measured was the hypothalamus and the lateral ventricles, and they showed that the hypothalamus atrophied less on a healthy diet. And in the hypothalamus, you have memory. Okay, that's where your memory is located, in that particular part of the brain. So there's the experiment. I wish I could give you the name of it, but it doesn't matter. You'll attend the lecture. And the other thing you do is you want to avoid dementia. And 60 to 80% of the dementia is due to Alzheimer's, which is caused by aluminum poisoning. And you can go to my website right now. You'll find 2 articles on Alzheimer's and aluminum. Just look it up. And then you'll hear the second part of that lecture when Heather and I give it again about how aluminum poisoning causes Alzheimer's. Plain and simple. That's what does it.
So what if this person has been eating this way for the last 15 years, 18 years, and now she's feeling some dementia? What is
a senior moment?
A senior moment, yeah.
So it must happen to a lot of people as they get older. So I don't know anything.
I mean, there's nothing to do after you start having these moments. Are there any, like you always hear about people saying,
I mean, you could take what's the name of that drug? That jellyfish stuff?
Oh, Prevagen?
Prevagen. There solves everything. Prevagen. Oh, by the way, the research done on that was done by one company who happens to manufacture Prevagen. And it's been condemned by the FDA, the medical letter, and AARP as being fraud. Prevagen is fraud, according to these organizations.
Well, I was thinking about brain exercises. I mean, do they help? You always hear about these things that you're supposed to do, like puzzles,
I don't know.
drawing lines, and
I don't know.
no?
I
Okay.
have no idea.
All right.
All I know is I have a hard time shutting my brain off. It won't be quiet. It doesn't go to sleep easily at night.
It does, that's for sure. But you've always been that way, so.
I don't know. I have to say that as we've gotten older, there are times when we say, this is a senior moment. But most of the time, I feel like I've at least compensated by my experience, anything I've lost by aging. And as I say, I'm 76 and Mary's 77. You'd expect someday that we're going to not be doing too well. Ladies and gentlemen, the McDougall diet does not prevent death. It delays it, but it doesn't prevent it.
Okay, thank you. Let's see, next question. We've got 4 minutes. We've got time for a few more. Are there any studies that have been done on post-herpetic neuralgia?
Yeah.
They
No,
had
no.
shingles
Yeah.
in September, suffers from severe pain.
It's terrible, Heather. I have people who have these kind of viral infections. Of course, shingles is supposed to be, and probably is, I have no doubt, due to latent chickenpox viruses that live in your nerves until you get older, and then somehow or another it appears. And the pain I've seen, I had one guy I used to windsurf with, and
Yeah.
remember John?
Mhm.
Yeah, he sat up for over a month because the pain was so severe he couldn't lay down. And so it's bad. What can you do about it? Well, you can put, sometimes there are doctors who put injections of long-acting Marcaine in the nerve area. And, I don't see that as being too commonly done. But then again, I'm not involved in that kind of practice anymore. Painkillers, you don't want to get addicted on painkillers. And otherwise, it's going to be a tough month. Aspirin's a good painkiller. Probably the best painkiller out there is plain aspirin. So it's a tough one. How do you prevent it? Well, shinglets, right? Shinglets.
Shingrix.
Was that the vaccination for
That's
shingles?
a vaccination, yeah.
And by the way, we have gotten it twice. All right. So you want to know what I feel about vaccinations is we take advantage of them. The ones that work. The flu vaccine doesn't work. Okay. So we don't get the flu vaccine. And if you have any doubt about what I said, look at the newsletter I wrote on the flu shot. When I say it doesn't work, it's far from being what is promised. It's been promised for the last 40 years to the public. Anyway, we'll leave that for another discussion. And likewise, I'm losing faith in the COVID vaccines. Come on, ladies and gentlemen, you've been listening to the news and reading the papers too. They came out with huge enthusiasm for the vaccine. It may have made a difference, but how many people are getting vaccinations now? And why not? Because of variants. The variants will always be here. And that's why you need to maintain excellent health, because you're going to be confronted with new and stronger pathogens. They're coming because the planet is warm. So Ebola is moving north and south. And these are really, really deadly organisms that you're going to be dealing with in the near future. And there are two ways of dealing with these viruses. One is by public health measures, masks, wash your hands, social distancing. This has always worked for thousands of years. People have practiced this. And the other way is to eat a good diet. You will prevent rapid deterioration into serious problems like death, mechanical ventilators, and hospitalization if you eat a healthy diet. Your risk is dramatically reduced.
Okay, I think that's a good thing to end on.
Okay.
More positive.
All right. So what do you got this program coming up in July, right?
Yeah.
Yeah.
We don't have, well, you haven't scheduled them yet, but you have your
And then in August,
weekly.
I have 5 lectures that I'm putting together for my colleagues. They're going to be CME approved, which means if you're a medical professional, your dietitian, your doctor, et cetera. Not sure, but we have some accreditation for dietitians too, nurses, et cetera. you have to have a certain amount of credit that you get from continuing education. These lectures are going to be approved so that you get credit. So it's worth your time to take it. Otherwise, you're so busy, you don't want to waste your time taking lectures that are valuable, but don't have CME credit. So we're going to get CME credit for you. But we're going to give those lectures to the public in August. So be aware of that, is if you want to sign up for those 5 lectures, whether you're a doctor or not.
Well, we'll let them know every Sunday night when they're going to be.
Yeah, we're working on those. We're going to do that. And Heather, we need to do the lecture on attractiveness, and we need to do the lecture on aging again.
Done. We'll put it on the schedule.
All right. We're so busy.
I know we are. That's good though. Being busy is good. It's better than the alternative. All right. Thanks,
Thank you.
Mom and Dad, Dr. McDougall and Mary. Thanks everyone for tuning in. We'll see you all next Sunday at 5 p.m. Pacific. Have a great rest of your day.